Miss Eleni Karayianni, welcome to our MediaBox platform. You are a psychologist and coming from the University of Cyprus.
Yes.
And you co-lead the research on the prevalence rate of sexual violence against children in Cyprus. So what are the main findings of this research outcomes?
Well, I think that the research was very important because before the project was conducted, we had no data to show the rates of prevalence or even incidence of sexual abuse in Cyprus. What we found was that indeed the 1 in 5 number was verified, actually, and in some cases it might be even higher or it might be even lower. So, for example, we had a rate of 19% reporting a case of being approached online for sexual solicitation and acts over the internet, whereas we had a lower number of 16.5% for verbal provocation, sexual provocation between the offender and the victim. And then we also found that sexual trafficking numbers were quite low in Cyprus, which is a good number for us. It's about 1% or right about there. But in general, I think that it was close to the 1 in 5, and it was concerning because before then the numbers were indicating a much lower rate, and people were having a hard time believing that sexual abuse occurs in Cyprus. So the other thing, though, that was interesting for us as a finding was the rates of peer abuse happening, so between underage children, and it wasn't a finding that we were anticipating. We were more anticipating adults perpetrating against children. And that sort of led us to different conclusions, or added conclusions rather, in terms of the prevention and the efforts that need to take place.
And in that context, what are your recommendations to prevent sexual violence against children?
Well, prevention doesn't always mean preventing something from happening. And in the case of sexual abuse, we can't really do that unless we start recognizing effectively the children and the families that are at risk. And that was definitely one of the recommendations that we made. So the earlier that we start getting involved, the services being involved and provided to these families at risk, the better it might be in terms of preventing the occurrence from happening, or the chronicity of the sexual abuse, because often, and especially when it happens in the circle of trust, it's a chronic event. It's not just a one-time deal. Pardon me. The other big result that was needed, or the need that was identified, was for education on all levels, for professionals, the need for having a general background and education on what sexual abuse is, what are the signs, and how it can be detected, but also more specialized in terms of how to deal with it, and identifying early on cases so that they do intervene as early as possible. For parents, the same, identifying the signs in their child and dealing with it in a way that will not put more shame on their children and on the children themselves. So helping children understand that their body is theirs, that they have the right to say no, and also in terms of peer relationships, what they can do and what they cannot do, and what respect means in a relationship. So promoting sex education from a young age in order to help them gain an understanding of relationships, whether it is love, trust, and care. In any format or context. Of course, we can go on and talk about prevention on all other levels, but I think that this is the most important part for our study.
And we thank you for all your clear messages and contributions.
Thank you.